here I am again at Goldson Chiropractic, Goldson Spinal. It's my 4th week with Dr. Fidel Goldson, and I must say I'm in a much better place now than I was 4 weeks ago. Today the physical trainer put me through the most rigorous routine I've done since I've been here. I don't think I could have really done all of what I did today 4 weeks ago. I'm not in any pain right now. I'm just tired and muscles are worked out. But I've seen definite improvement in terms of flexibility. I've seen improvement in terms of the strength I feel in my hips and my groin, and I'm still largely pain-free. So I would say coming here has been very rewarding, and I'm very grateful for the progress I have made. And an important thing, you got to do your homework. So what I do here today is very good, but you have to do a little bit of stuff at home on your own, and I've been doing that and it's worked for me. So you know, you do the same. It might work for you too.
Hey everybody, Dr. Goldson here with Jabulani, and I'm extremely pleased and very happy with his progress over these past 4 weeks. And the whole goal when we started was to educate you all on how to avoid total hip replacement when you have hip pain or hip arthritis. And you saw the work that Jabulani put in while he was here. And that's the big part of it. First, you have to make the decision that you're going to put in the work to avoid it, because there's no way around it if you don't. The whole goal again is increase flexibility, increase strength, and improve overall function, so that you can move around, you can do the things that you want to do without the hip pain. The things that we stretched was flexibility. Now on week 4, what I can notice is the definite improvement in hip flexion. His hamstrings are a lot more flexible than we were. We still have room for improvement, but this is a lot better. He's already told you how well he feels and how much more function he has. But from a chiropractic standpoint, consistency is the key. So if you're trying to avoid surgery, what you do on your own at home is crucial. But the truth of the matter is, a lot of times people, you know, you could go to the gym. We've shown you what to do, but sometimes it takes motivation to get started. And that's what we're here for. We're here to get you started. We're here to show you exactly what the specifics of your condition are. We'll take your x-rays. We'll look at where you are compared to where you could be, give you a treatment plan, motivate you, educate you on the exercise that you need to do so you can move forward just like Jabulani did here in progress. So before week 1, on this right side, if we were to come here, there was going to be tightness and stiffness. At this point, we can rotate it around. We can almost get it at least double of where we started. So I would call that almost 100% improvement as far as function and flexibility. 3, 2, 1. So the question is, well, if the stiffness or discomfort started here before, and I can go this far, do I progress? You gotta always continue to progress. That's where the consistency comes in. I take it like this. If you want it on a good stretch, if you have pain, you want to back off the stretch just a little bit, because your body will start to guard itself if you move too fast or too much into the stretch. Again, consistency. 3, 2, 1. Relax. 3, 2, 1. And it doesn't have to be all work. You can turn it into a challenge for yourself. You can turn it into fun while you're getting better. But the whole point is you can be better. You can actually you can avoid surgery. You have improved function. This left side, this is just amazing. Great. A lot more hip flexion with this. 3, 2, 1. Much better hamstring flexibility. And the reason that you have to add in stretching amongst the exercise that you saw Jabulani do is because if the muscles get stronger without flexibility, they can actually cause more restriction around the joint. So you can get stronger and that strength can cause more restriction. So you have to balance it out with flexibility and strength. 3, I got you. 2, 1. Good job. Very good. Very good. 3, 2, 1. Best part of my job overall is to work with people who have come in with pain or discomfort, put a plan together where they're an active participant in their healing. If I can adjust you and you feel better, that's great. But if I can adjust you and you can feel better, and in addition to that, you can walk away with knowing exactly what type of stretches and exercises you can do and empower yourself and to improve your life, there's nothing better than that for me. So the goal is to take charge of your life, take ownership of it, accountability of it. It takes work. It's hard to get up sometimes, and it takes motivation. That's what we're here for, to encourage you, to motivate you, and show you the right things to do. 3, 2, 1. Flexibility much better. 3. Relax. Good. 3. Drop that leg out to the side from the Jabulani. Now, this side is not as impacted, but that's not as impacted. But still, we have more flexibility here across the hip than we started off with. 3. This is much better. I would call this, even though not the affected side, I would at least call it 70% better than when we started. And quite frankly, are we looking for the arthritic changes to turn around and go back? We're not. We're looking for increased function, increased mobility while they're there. I got you. And let it drop to the side. That's much better.
Yeah.
That's much better.
I can feel it.
That's much better. Because this is a difficult stretch.
Yeah.
For even if you don't have hip arthrosis or hip arthritis, this stretch is hard. Try this at home. This is a hard stretch for a lot of people, and I think when we started, we were probably right here, way up there with the tight.
Pain when you start
exactly.
And I'm not feeling the pain right now.
We dropped this down.
Yeah.
Much better. I would say we're probably like 30% off of the left side, the normal side. 2, 1. Very happy with that. Let's do that one more time. Okay.
Yeah, I feel that improvement.
And what I'm noticing is, in addition to that, I'm looking at the muscle tone. So once you've had hip pain, you avoid putting pressure across that side. What that does is, yeah, it may reduce the amount of symptoms that you have on that side, but it's also going to reduce the neurological input to that side. You're going to notice weakness in that side. The muscles are going to get smaller on that side. But what I'm noticing with Jabulani here, the tone is coming back, the muscle density is coming back, in addition to having the flexibility. It's great. Let me help you up, sir. All right, so now we're checking the hip flexors. We have more mobility there. I'm gonna take the time to really thank Jabulani for being a participant in this and actually just expressing his journey along these 4 weeks with you guys. I know at some point that someone's going to be positively impacted by this, because hip pain does affect a lot of people. As we progress and get older, if you had a sports injury before, if you had an auto accident before, slip and fall before, or just generally you had something going on with the hip, as we get older, it's one of those joints, because it's such a weight-bearing joint and so much weight goes through it, it can degenerate fast. So there's a lot of people out there with hip pain, and you're thinking about, what do I do with my hip pain? And again, thank you, Jabulani, for showing that you don't have to go underneath a knife in order to prove your condition. And it does take work, it does take commitment, but overall, thank God that He's given us a body that heals itself. All right, so this being the impacted side, let's check this out. Much better. If you go back and look at the videos that we put out from week 1 to now, this is much better than we were. This is called hip extension. The hip flexors, which are the muscles on the front of the hip, just that's what we're stretching right now. But the motion that I'm actually moving to is called hip extension. So that's really important in order to pull your leg through when you're walking, and just having free flexibility so that you're not having that sharp pain. 3, 2, 1. Hey, can I speak to the ladies, Jabulani, for a second? Mm-hmm. All right, so I'm gonna point this out. A lot of our exercises are geared towards the glutes, because the glute muscles, the buttock muscles, are the stabilizers for the hip, and they help us to extend. Jabulani's tone and his glute muscles are definitely developed over 4 weeks. When do we expect to see an impact? After 2 weeks. The first 2 weeks, your body's getting adjusted. There's going to be some soreness. You're gonna walk, when you wake up out of bed, you're gonna be sore, but that's a good soreness. That's called delayed onset muscle soreness. That's basically speaking to the tearing that takes place in the muscles as they're basically being rebuilt. So you're gonna have that, but that means it's a good thing. If you have that delayed onset muscle soreness after starting an exercise program and you stop, you've wasted it. You have to build on top of that, and that's exactly what Jabulani's done. And I see that his not only the tone in his right leg, but also his glutes have definitely become more defined, and that just means we're going to have more stability and more power overall. Come on up, sir. we're going to finish off with an adjustment. Lay on your side facing me, please. Come a little closer to me. Thank you very much. Lifting the shoulder up like here. This goes on top. Straighten the bottom leg out for me, sir. Thank you. Right here is good. And just relax for me, okay? Relax. I got you. 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 One more time. There it is. Yes, I got you. Straighten that bottom leg out. 1 minute. Hold on. Relax, 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 relax. Good. Beautiful. Lay flat on your back for me, please. I'm going to do your neck now, okay? Why do I adjust the back and the entire spine and then we're treating his hip? What nerves, or where's the origin of the nerves that innervates or goes to the hip? It's our entire spine, especially our low back when we're talking about the hip. So if I want to have improved neural input, improved nerve input, improve communication from the brain down to the hip, from the hip back up to the brain, which is called afferent and efferent communication, information going down, information coming back up, I have to clear the pathway. I have to make sure we balance out any restrictions. That's where the adjustment comes in, so that we can actually remove subluxation, and which could be interfering with nerve information flow. And just relax right there, sir. Relax your head, I got you. Go on top. Good. Sorry. Let your head relax. Good. Good. One more time. Good. Let it go. Come on up, sir. So it's been a journey. I really appreciate this man. I absolutely love this man. I've known him since I was a teenager. He was a friend of my dad, so I appreciate you, sir. Thank you very much. And thanks for providing all the information and the hard work to the people out there.
And I'm blessed. I was treated royally by Dr. Goldson Sr. and now I'm being treated royally by Dr. Goldson Jr.
Amen. God bless y'all.